Welcome to the Root of It All, the State of Mental Health Conference of New Orleans Youth, hosted by the Institute of Women and Ethnic Studies, as well as Dillard University's Deep South Center for Environmental Justice. This event is funded in part by the W.K. Kellogg Foundation, the United States Department of Health and Human Services, Office of Adolescent Health, as well as the New Orleans Musicians Assistance Foundation GIG Fund. We are proud to host this event today here at Dillard University, which is designated as a historically Black college and university. HBCUs have a rich history and commitment to the advancement of minorities and play an important role in the community. It is for those reasons that it is an honor for us to host this event here today. It is our hope that you will leave this conference today more informed and empowered to work with our community and our youth to better meet their needs.
That gets lost sometimes when you are looking at numbers is the context and the history and the importance of understanding a life course narrative. And so I think it was really important to start with this. All of us embody our history. All of us embody the places in which we've lived. All of us embody an accumulation of stress that we've carried over our life course. And that's what I've spent the last 10 years or so studying and looking at both the social determinants and consequences of poor mental health and poor access to services, inequalities, and the way in which we can address these. I've had the pleasure, and it's a great honor for the past 3 years, to serve as a board member at the Institute of Women and Ethnic Studies. As many of you know, this is a nonprofit organization that was established in 1993, and they do tremendous work in the community and really take a holistic approach, very much the way in which I like to conduct my research, in a very holistic way. And I have benefited greatly over the last 7 years, although I do miss living in the United States. In the last 7 years, I've lived in London. And benefited from witnessing a different approach to caring for people, a different approach to providing health services. So the first thing that I want to do today is to stand here and to tell you that no, we do not have death squads. Universal health care is amazing. It is a human right.
Amen. Thank you.
Think of healthcare and the community around healthcare in the same way that you do around other issues. I pay more taxes so that myself and my neighbors and people I don't know in my community and the communities around us can have healthcare. Okay, this is what it's about. My general doctor sees people in my community, my neighbors. The research that I do at the Institute of Psychiatry is I do it to inform the clinicians and policymakers in the National Health Service. That means that I improve my services in my boroughs of London, in South London. So this is what I feel very passionate about and felt very strongly about being involved with IWES, because the model they have is a translational model. It used to be called applied research. But this is really about translation, and it's time for people to stop doing research for research's sake and to really consider the impact that they can have. So when I was asked by Dr. Shervington to take a look at some of the data that had been collected, some of the voices of the young people, because again, reading out the narrative gives you this sense of time, this sense of life course, this sense of context and history. But don't let that get lost in the numbers that I'm going to present to you, because these are the collective voices of the youth that were involved in the Believe in Youth NOLA program, the Buy NOLA program. And this was an important program that involved 8 modules, evidence-based interventions on HIV and pregnancy prevention. But one of the things that was so amazing about what the funders allowed them to do was to add 2 additional mental health modules to go alongside the other modules that were being delivered. So Dr. Shervington worked, and with the advice of her colleagues, brought together a series of questions and screeners that would get some baseline information to inform the interventions and the work that they were doing in the community. And so they went and asked questions to the young people, something we don't do enough of, and asked them about their mental health, how they were feeling, what experiences they had had. And you would be surprised what young people are willing to tell you. And I just want to say that, these are, when we start talking about stress and we start talking about exposure to violence, I want you to keep in mind that we're both talking about acute events, one-off events, but we're also talking about chronic strains, things that go on for indefinite periods of time sometimes. Sometimes it will, it may come along at a critical period. Well, I should correct myself. This is a critical period of the life course. And I'll go into a little bit more about what the long-term consequences are of some of these exposures, where they started to really think about the impact that this may have on children. So what you see here are the proportion of those who reported witnessing violence between their parents or their parent and a boyfriend or girlfriend. And you see it's about 1/4 of those that were who reported it. We also see how many of those witnessed violence between the parent and a sibling in their home. You see a very 29.2% total of those who have witnessed assault, and that's assault with a weapon. And then also, and probably not surprising to you, 13.6, near 14%. Who had witnessed a murder. So let's remember that they're 11, between the ages of 11 and 15. And as we heard in the narrative, for some, there is the experience of forced sexual intercourse. And among the young people who were asked the questions, 2% reported this, and more of the girls than the boys. So among the girls who reported, we had about 3% that reported experiencing this, and among the boys, just 1%. Intimate partner violence. So this is asking about whether or not you have been hit by or abused by a boyfriend or girlfriend. And total 6% of the young people reported this. And at first, I was looking at the data, I thought, okay, and I broke it down by gender, so 12.4% of the young men reported this, and it's something that does need to be explored, and so that was a significant difference between the boys and girls who answered these questions.